Good afternoon, everyone. With a show of hands, have any of you had a seizure? No? Good. I would never wish that on any of you. Now raise your hand if you know someone or have seen someone have a seizure. Pretty scary, right? Now, my first experience with seizures was in 10th grade geometry while taking a quiz. My best friend, Ryan, who was sitting next to me, fell to my feet and began to seize. I, being the great friend that I am, made sure he made it to the hospital, and we still joke about it to this day that we passed that quiz because we got to study for an extra night. And if you guys probably can't tell, we're going to be talking about seizures today. My name is Brandon LaJoy, and I am here to talk about why cannabis can be used to lower the chance of experiencing seizures. According to the CDC, as of 2020, just over 1% of people in the US have epilepsy and experience seizures. And despite ongoing debates and legal complexities surrounding its use, scientific research consistently demonstrates the potential of cannabis, particularly cannabinoids such as CBD, in effectively preventing seizures in individuals with epilepsy and other seizure disorders. Any seizure can result in the death of someone having one, and with the help of cannabis, seizures can be reduced. It can reduce help with a lack of sleep in insomnia sufferers, reduce inflammation in the brain, and there are some neuroprotective effects, just to name a few. First, you must learn about seizures. There are two different types of seizures: generalized seizures and focal seizures. A generalized seizure, which is considered the more common type of seizure, occurs when the abnormal electrical activity causing a seizure begins in both halves of the brain at the same time, according to Johns Hopkins Medicine. Spasms, stiffness, shaking, muscle contractions, or a decrease of tone in the muscles may accompany a loss of consciousness. And then there are focal seizures. According to nationwidechildren's.org, during a focal aware seizure, you stay fully aware of what's happening around you, even if you can't move or respond. This type of seizure used to be called a simple partial seizure. According to the Center for Disease Control, 1 in 26 people will develop epilepsy, as it's the fourth most common neurological disorder in the world. About 3 million adults in the United States actively have epilepsy, with 470,000 children actively having epilepsy in the United States. One of those children happened to be Charlotte Fiji, a little girl from Colorado. She had Dravet syndrome, a severe kind of epilepsy. At 5 years old, she couldn't talk. She unfortunately required a wheelchair. She experienced frequent cardiac arrests and had up to 300 grand mal or tonic-clonic seizures every week. This is the most common type of seizure. She then began to take an oil infused with a cannabis strain that was strong in the component of cannabidiol, or CBD, but low in THC. THC is what gets you high and baked. But CBD is used to calm you down a little bit, and this is why she used it. The plant's psychotropic ingredient, Charlotte's symptoms mostly went away, but sadly in 2020, she passed away at the age of 13. Seizures took the life of a sweet, innocent girl, and this is what caused the seizures like her. Epilepsy. Epilepsy is a neurological disorder characterized by recurrent seizures. It can have genetic factors, developmental abnormalities, brain injuries, infections, or unknown causes. According to Mayo Clinic, the common cause of seizures is epilepsy, but not everybody who has a seizure has epilepsy. Lack of sleep. Lack of sleep can easily cause seizures. This is why cannabis can help in preventing those seizures caused by a lack of sleep. Certain strains of medical marijuana can help improve sleep quality for individuals with insomnia or other sleep disorders. In my personal experience, I used to take melatonin, but I personally struggle for trying to fall asleep. So I would use melatonin. Melatonin started to give me some wacky, jacked up dreams that I was just not cool with having anymore. So I talked to my doctor, and she suggested marijuana. So I went to the dispensary for the first time, got a little joint, and I would hit that a couple times before I would go to bed, and it would put me right to sleep, and it was perfect. It was awesome. Another cause of seizures is traumatic brain injuries. Traumatic brain injuries resulting from accidents, falls, or blunt force trauma can lead to seizures, like frequent seizures. And then there's genetic factors. Certain genetic disorders and mutations can predispose individuals to seizures and epilepsy. Examples include Dravet syndrome, which Charlotte had, Lennox-Gastaut syndrome, and tuberous sclerosis complex. And then there is obviously the simple solution, using cannabis. It can prevent seizures. Cannabinoids have the potential to lessen abnormal electrical activity in the brain, which could result in fewer seizures by specifically targeting pathways related to neuronal excitability and neurotransmitter modulation. Studies have shown that CBD has neuroprotective properties. It has the ability to shield neurons from oxidative stress, inflammatory responses, and overstimulating the nervous system with neurotransmitters. CBD may lessen the effects of seizures and help prevent them by protecting the integrity and function of the neurons. Research has shown that cannabis has prevented the occurrence of seizures despite debates and ongoing legal complexities. Seizures have been caused by such things as epilepsy, lack of sleep, and traumatic brain injuries, and are being prevented with the use of cannabis. And to finish, if you or someone you know is having seizures constantly and you want to help them, I strongly encourage you tell them to talk to a doctor about medical cannabis.